Hi guys, hope you're all doing great. Today we are gonna discuss acute renal failure or acute kidney injury. Any condition that leads to a decreased renal perfusion can be considered as an acute kidney injury. Before going to the topic, let's discuss some of the important terms. One such term is oliguria. A reduced urine output of less than 0.5 ml per kilogram per hour is considered as oliguria. Another one important term is azotemia. Increased levels of BUN and creatinine is known as azotemia. If this is accompanied by symptoms like encephalopathy, asterixis, platelet dysfunction, pericarditis, nausea, all these things are known as uremic symptoms. If these are present along with azotemia, you call it as uremia. Okay, now let's go to acute renal failure. What are the causes of acute renal failure? There can be basically three levels of causes. One is pre-renal, next is intrinsic, and the other one is post-renal. Pre-renal causes are basically caused by reduced blood volume or reduced BP. What are the causes of reduced blood volume or hypovolemia? Hypovolemia can be caused by heart failure, sepsis, anaphylaxis, or in conditions where blood flow to kidney is reduced, like renal artery stenosis, due to NSAIDs, diuretics, AC inhibitors. All these things can be causes of pre-renal failure. There are some other conditions like cardiorenal conditions and hepatorenal syndromes, which can also be considered as pre-renal causes. Basically, in this pre-renal causes, BUN levels and creatinine levels will be highly elevated. BUN levels are so elevated that it leads to an increased levels of BUN to creatinine ratio also. Urine sodium will be less than 20 and fractional excretion of sodium will be less than 1% in case of pre-renal causes. Urine osmolarity will be more than 500. That can be one of the differentiating features that help you to differentiate the cause of ARF. So this pre-renal cause and the post-renal cause, which will be discussed next, can be treated basically by treating the cause. Now, post-renal causes includes a condition that leads to obstruction of ureter or urinary bladder, like BPH, bilateral like obstructions of ureters that are caused by tumors, congenital anomalies, renal calculus. All these things can be easily identified using an ultrasound of bladder and renal ultrasound. Sometimes a bilateral hydronephrosis or a hydroureter can also be considered as a post-renal cause. This post-renal cause can easily be treated by urinary catheterization sometimes, and patient feels much better after a catheterization. Now comes the most important cause, that's intrinsic causes. These intrinsic causes includes acute tubular necrosis, glomerulonephritis, and sometimes use of toxins like amphotericin, cisplatin, cyclosporin, NSAIDs, some contrast used for scans and all. All these things can sometimes precipitate as abnormal sediments in urine like proteins, CAS, RBCs and all. The specialty of intrinsic renal failure is, in case of that, urine sodium will be elevated, but urine osmolarity will be somewhat normal, like almost a 350 and all. Fractional excretion of sodium will be increased, sometimes 2 times increased. This helps to identify or differentiate the cause of this acute renal failure. So basically, if you are suspecting a patient with acute renal failure, we have to order for a creatinine, BUN, urine sodium, and fractional excretion of sodium. Sometimes stopping the drugs that's precipitating the condition will make the patient feel much better. Another one important topic you will come across while reading this ARF is indications for dialysis. Dialysis indications can be remembered easily by a mnemonic A, E, I, O, U. A for acidemia, E for electrolyte imbalance like an elevated potassium level. I for intoxication of drugs or an overdose of drugs. O for overload of fluid like a congestive heart failure. U for uremic symptoms. This uremic symptoms includes encephalopathy, pericarditis and all. So, basic investigations for acute renal failure includes creatinine levels, ultrasound for renal ultrasound, urine analysis, urine sodium, fractional excretion of sodium, serum sodium, potassium, and creatinine levels. All these things helps you to identify the detailed cause of this acute renal failure. And while we are progressing with the treatment, you should monitor this blood BUN levels, creatinine levels, daily weight, fluid intake, salt intake, BP, electrolytes, all these things should be monitored also. So that's about acute renal failure, the causes, investigations, and indications for dialysis. I hope this video was useful for all. Thank you.